Goal setting. Goal setting can be a really good tool for you as part of your recovery, and when done correctly, can be really effective. When we're looking at goals, it's important because it gives you something to aim towards in your recovery. You get that great feeling of achievement once you get there, and goals can change and they can become like stepping stones. So once you achieve one, you sit down and you make a new one and you move on, and they're relatable to your current level in your recovery at that point in time. When we're thinking about what goals can look like, it can be something like walking the dog, or going up and down the stairs easier, or socializing with friends and family for a bit longer. These are great goals. However, to make a goal effective, we look at SMART goals. So that means being more specific with your goal, making it measurable, achievable, relatable, and timely. What does a specific goal look like? So it's finding out what your goal is. Maybe it's more than just wanting to not be in pain anymore. So you can have a think about, what must you reduce due to your pain? What can I still do in my current level of pain? Can I use this to increase my tolerance gradually? And what is the next step up from where I currently am? So that could include something like, you're able to walk for 10 minutes at the moment. Would you be able to walk for 15 to 20 minutes, even if you took a break in between? Measurable. So your current levels. So if you're thinking about the walk, for example, you're able to walk for 10 minutes. It may be that you're able to do 10 sit to stands or 10 press ups, but you're looking at what you can currently do, and then over the next few weeks, where can you aim for? So maybe aiming to do 15 minutes of walking, or 15 sit to stands, or 15 press ups. Making your goal achievable. Your goal should be reachable within a shorter period of time. So if your goal is not achievable within sort of 3 months, then you should look at perhaps a smaller goal for that time and make those steps along the way to be able to get to that bigger goal. For example, exercising for 15 minutes 3 times a week is achievable if you know you have that time to do so. Trying to fit it around your diary, so maybe figuring out, is mornings or evenings work best, and can you keep up with it to make it a habit? Realistic. With goals, it's easy to be overachieving, but that makes it difficult because when you don't achieve that goal within a short period of time, it can be give you a bit of a setback. So we're not looking at becoming marathon runners or aiming to rearrange and decorate a room within a day. Expect things to take longer. There can be setbacks, and that's fine. There is natural up and downs on the journey of recovery. So setting those smaller goals makes it more achievable and more realistic. You may have to get help along the way. So speaking to your GP regarding pain medication, a physio to help you achieve those goals and what is needed for you to get there. You could potentially have other modalities such as a corticosteroid injection, and a key element is having that motivation from your friends and your family to keep you going when there is a bit of a rough day. Timely. So when we're looking at goals, we're looking at a shorter period of time. So not 6 months, 3 months down the line. Can you achieve this goal within 2 to 3 weeks? Make your goals bite sized so there is a finish line. If you don't reach it, you can then think about how far you've come. Are you a week away? Does it need to just be extended for a little bit? If you are very far away, such as months away, then maybe sit down and rethink your goal and think about where your current level is, and make smaller goals in between so you can reach that bigger goal. So, take home messages. So, goal setting allows us to see our progress more clearly using numbers, so making sure that it's measurable. Thinking about how many minutes of walking you can do in that day or number of squats. Feelings also matter. So, do I feel less tired than what I did last week? And that can be a goal. As you achieve your goals, make sure you write them down so you can see how far you've come. And these are helpful when you're having a setback. It's easy to forget about how far you've come on a rough day. Looking at what your goals were 2, 3 weeks ago and where you are now can help give you that motivation to keep going and keep moving on to your next goal. Remember, recovery is always up and down, but keep moving towards those short term goals and keep that motivation going.